Shutter Island Movie Project. Case presentation Edward Teddy Daniels / Andrew Latus by Analiese Belt and Caitlin Hammack. Description of Shutter Island. The film Shutter Island is a story of a U.S. Marshal Edward Teddy Daniels and his partner who travel to Ashcliff Hospital for the criminally insane on the isolated Shutter Island in 1954. Daniels and his partner investigate the disappearance of Rachel Solando, a woman who became a patient for the drowning of her children. Clue by clue, Daniels increasingly questions Ashcliff and its rehabilitation methods. As time passes by on the island, Teddy begins to experience disturbing dreams, migraines, and flashbacks of his trauma in Dachau during World War II. He experiences memories of his wife, Dolores Channel, who was killed by Andrew Latus, but these experiences transform into severe hallucinations, leaving Teddy with a craving to find Latus. Daniel's delusions help him piece together the mystery of Ashcliff and the purpose of him being on Shutter Island.
Diagnosis. In the movie Shutter Island, the main character is named Andrew Latus, who suffers from hallucinations of his life and creating a false persona due to a traumatic experience in the past. The character has a doctor working to try to help him with what is clearly severe schizophrenia, along with PTSD. Schizophrenia is considered slightly different in all cultures. However, with the severeness of the schizophrenia the character has, it would likely be diagnosed in all cultures. Schizophrenia is the most stigmatized mental disorder, one of them being that schizophrenia occurs from trauma, which is true regarding this movie, however, is not always true. Some other stigmas around schizophrenia is that they are chaotic and violent, which once again is not true in all cases of schizophrenia. Evidence. One symptom of schizophrenia that Andrew Latus displays is hallucination. The whole movie is created up from his hallucinations. He's hallucinating his whole life, creating a false reality to try to escape his real past. He is hallucinating that he is investigating a missing person from an insane asylum on an island, when he is truly the missing person. He hallucinates seeing the missing person in a cave, even though the missing person he is looking for does not exist. So there's not really another person in the cave with him. Along with that, he displays symptoms of delusions and creating a sense that he is an investigator and changing up what truly happened in his past. He has flashbacks from his life that had happened, such as when he thinks about how his wife died. In his flashbacks, he thinks it is from a fire in the apartment, which is not truly what happened. This is because what truly happened is so horrible and he is choosing to not relive it. One symptom of schizophrenia that is not displayed in the movie is disorganized speech. He is very clear with his wording, allowing other people to clearly understand what he's thinking. Treatment. The treatment in the movie was a process of allowing him to act out his hallucinations and eventually get him to understand what truly happened in his life and how what he is hallucinating is not real. Ultimately, this treatment only lasted for a little bit until he fell back into his hallucinations all over again. Also, the treatment involved the character having to stay in the same asylum in the island with no escape. The ethical concern is that he is having to relive the horror he's creating in his head over and over again, and having to relearn who he really is after hallucinating every time, causing him to continue to experience the pain of remembering all over again. The barriers from the character receiving a lobotomy, which is a typical treatment for schizophrenia at the time it was set in, is that it is expensive as well as a very risky procedure that can lead to bad effects of if it is done wrong. With this, the doctors are trying to help him without having to go through any major brain surgery. However, it is just not working.
Broader perspectives. The movie portrayed an accurate representation of an individual with schizophrenia because of the main character's symptoms. The severe hallucinations portrayed through the eyes of the main character allowed the audience to experience the struggle of distinguishing sensations of reality versus delusions. However, it is important to recognize that not all people with schizophrenia had traumatic experiences. The main character suffered with trauma of his wife drowning their kids, the guilt of killing his own wife, and World War II PTSD. Outside the movie stigma, the broader perspective is that people without trauma or PTSD can be diagnosed schizophrenic as well. In addition to that, the movie had an inaccurate portrayal of a frontal lobotomy as a treatment course. In the context of the year which the movie was set to be, the 1950s, lobotomies were commonly used as a last resort treatment option. In actuality, a lobotomy does not erase the mental illness, unlike the movie suggests in the quote, which would be worse, to live as a monster or to die as a good man. Lobotomies report with a small percentage of people benefiting from the surgery, but many patients experience loss of initiative, empathy, or ability of independent function. Thank you.